Younger children now a step closer to being able to receive the COVID-19 vaccine after an FDA advisory panel recommended the Pfizer shot today for kids 5 to 11. Joining us in today's KSAT Q&A, we got pediatric infectious disease specialist Dr. Tess Barton from UT Health San Antonio to talk about what this means, what you're seeing when it comes to COVID in kids. So let's start with that recommendation. What should that signal to parents today who want to get their kids vaccinated?
So I think this is the first step in potentially getting as many members of your household vaccinated as possible. The next step is it goes from the FDA to the CDC to make kind of what the final recommendation is going to be as far as the schedule and the rollout. But I think that this was a unanimous decision with the FDA today, and I think that we can anticipate that vaccine is going to be ready to give to kids even as early as next week.
Is there anything in the timing of this study, what was found in the study? I mean, do you have any reservations about recommending this to children that are between the ages of 5 and 11?
I don't. First of all, the vaccine was found to be very effective as far as how well it provides a layer of protective antibodies to children. It's actually why the dose is lower, is because they responded so well to that lower dose that their antibody levels were the same as adults. And then in the trial, as they followed the children, all of the infections that occurred in both the vaccine group and in the placebo group were actually after July. So that was during the Delta time. They didn't have information on specifically whether those breakthrough infections were Delta variant, but overall, the level of protection was about 91%, which is pretty good.
Let's talk about the issue of myocarditis. We know that we saw some cases in adolescents and teens who got the vaccine. So is that something, for parents who still have that on their minds, is that something they should be concerned about when it comes to younger kids getting the vaccine?
So, I think we did see that. It's luckily a very, very rare side effect. So the myocarditis is a heart inflammation, and that occurred in about 1 in every 15,000 or so teenage boys. That was sort of the highest risk, was in the teenage boys. And so, the current trial for the younger children, that's such a rare side effect that they didn't find any of those cases, but they didn't have, more than 15,000 children enrolled. So I think that, as we roll out this vaccine, certainly, the CDC and, of course, individual doctors are all going to be, on the lookout for any signs of heart inflammation. But based on the trial data and based on the rarity of that side effect in the teenagers, I don't have any reservations recommending it. I think that the benefits actually outweigh the risk.
When we talk about myocarditis too, and you talk about heart inflammation, obviously it's a concern. Is it something that stays though, or does the condition improve over time?
Right. So all of the cases of myocarditis or pericarditis that were associated with the vaccine were cases that resolved. So, lots of things actually cause myocarditis. So viral infections cause myocarditis. And in fact, COVID itself causes myocarditis. There was a study in college athletes, and about 2% of them actually developed myocarditis when they got COVID. That's 1 in 50. So but it tends to be something that self-resolves, meaning that it flares up usually within a week or two of getting that second dose of the vaccine, and then it fades away over the next couple of weeks. Many of the kids did require hospitalization. I mean, it's not, it's certainly something serious and that we would want to keep an eye out, but it is very rare.
Can you talk about what you've been seeing in kids who have come down with COVID-19, especially, at the beginning of the school year, there was so much stress and anxiety for parents with the surge of the Delta variant. Speaking from personal experience, breathing a sigh of relief now with the numbers being lower. But what did you see in especially younger children who came down with COVID over the last couple of months?
Sure. So it's true that most kids, 90 99% of kids are going to have like a mild respiratory illness or a flu-like illness that comes and goes and that doesn't result in hospitalization. But we certainly did see kids who, I saw kids who had strokes. I saw kids who have pulmonary emboli, which is a big clot in the lungs. I saw kids who had, heart inflammation, and I've seen some kids in my clinic who are these sort of long haulers who have, chronic fatigue or joint pains or chronic muscle aches and brain fog and things like that. So, we certainly have seen those in kids.
Would you call today's approval a game changer?
As much as I want to say, yeah, I think that really the big game changer was actually just getting a vaccine, period, for adults. I mean, adults are really the ones who bear the brunt of this infection. But I think that having this vaccine available for children really gives families sort of another tool in their toolbox to help them to keep this virus out of their household, to protect the vulnerable people in their family, whether it's a grandma or somebody who's got, diabetes or obesity or cancer. It's something that can help to protect the teachers at school, to keep everybody working and, keep everybody in childcare. And so I do think that it sort of adds yet another layer of help, of the things that all the little things that we can do to get over this virus.
With where we are now and the potential for this vaccine to be ready in a matter of days for kids 5 to 11, what's your main message to parents who are watching this?
So my main message is that, this vaccine has shown itself to be quite safe, and it's very effective at preventing serious COVID, and it's pretty effective at preventing getting COVID at all. And so getting your kids protected will, especially as we're coming on winter virus season, we're getting over a surge, and let's just not have another surge. So I think getting as many people immune to this virus is the way that we're going to get through it. And it looks good for kids, it looks safe for kids, and I think it's a great thing to be able to offer them.
Encouraging words from Dr. Tess Barton, an infectious disease specialist, pediatric infectious disease specialist at UT Health San Antonio. Always appreciate your time.
Thank you for having me.
We'll be right back.